Hi, my name is Caleb Higginbotham, and today I'm going to be talking about hand hygiene, specifically in the pediatric population. I find these tips might be able to help you decrease your medical bills and increase your attendance at school. Today I want to talk to you about the importance of hand hygiene, when it's appropriate to wash your hands, hand washing techniques per the CDC, when it's appropriate to use hand sanitizer instead of hand washing, and also how a lack of hand hygiene can lead to increased doctor's visits, increased hospital stays, and time lost from school as well. So we're going to get right into it. So washing your hands, we know, is the most effective way to prevent disease, infection, and from bacteria getting into your body. So what is an infection? What are germs? An infection is a disease caused by microorganisms. These are the germs that are bacteria. They could be viruses, they could be fungi, and the list goes on and on. The trick with these microorganisms is that they aren't usually in your body. So they are invading microorganisms that aren't welcome in your body. They invade the tissue and they wreak havoc on your body, causing you to have certain infections that lead to certain symptoms that'll leave you feeling really uncomfortable. These germs may cause illnesses that include, but are not limited to, the cold, the flu, the stomach flu, any type of foodborne illness such as salmonella, and we even see stuff related to Lyme's disease. And the list goes on and on. These germs spread easily from one person to another, and one of the most common ways that people catch these illnesses, especially in the pediatric population, especially the elementary pediatric population, is by not washing their hands. So you'll see that there are so many germs that contaminate either doorknobs or cafeteria tables, desks, after using the bathroom, not washing their hands. These children are around germs all day, every day that they are at school, and they aren't washing their hands for a variety of reasons. And then when they don't wash their hands after having all of these germs, they tend to touch other children. They tend to touch themselves in like the nose area, their eyes. They rub their eyes. They might put their hands in their mouth or an object in their mouth after it's touched one of the contaminated objects. And so that really leads to the spread of the infection. And if you think about a school, you're in such tight quarters, especially with your classmates, that it's nearly impossible for these children not to come in contact with germs or other children that are infected. So hand hygiene is very important when it comes to these children and keeping them safe and keeping them germ-free and infection-free. And just a side note about germs, especially with these surfaces, these germs can live on any of these surfaces, such as doorknobs, cafeteria tables, desks, and whatnot, for 2 hours or more. So there's a prime chance for these kids to come in contact with these infected items throughout their day. So we'll move on from there. These different types of bacteria and infections, they cause different types of symptoms depending on what the illness is. So your child might experience symptoms that are like a cough, a sore throat, a runny nose, their eyes might itch. They might experience symptoms that are related to the gastrointestinal system, such as nausea, vomiting. They may experience diarrhea or abdominal pain, or the list varies. And so the important factor is just to avoid this as much as possible, because according to the CDC, about 1.8 million children worldwide that are 5 years old and younger die each year from some sort of disease related to diarrhea and pneumonia. Those are the top two killers of young children around the world. And the simple prevention method for this is washing your hands. Now, granted, around the world, they might not have access to the soap and water that we are privileged to have access to here in America. So those numbers are a little skewed. But here in America, we have the luxury of having soap and water, or most of us do. And so it is very important for these especially pediatric children, to be washing their hands to avoid these infections, because a lot of these kids have a suppressed immune system. They're still growing, and their immune system is developing, and so they might be more prone to these types of infection. According to the CDC as well, hand washing was shown to prevent 30% of diarrhea-related sicknesses, as well as 20% of respiratory-related sicknesses. So this shows that proper hand washing with soap and water can decrease the amount of visits to the doctor, thus decreasing your medical bills. And it will also reduce the amount of antibiotic use. Why is this a big deal? Well, when doctors prescribe antibiotics, sometimes they aren't related to the actual disease that the child has. And so the child becomes, at this point where the bacteria or whatever organism they may have in their body, they become antibiotic resistant. And so this could also help prevent any type of antibiotic resistance in the future, or any that might develop. And so we have this question of why do people, especially children, choose not to wash their hands? And there are a number of reasons. Number one, children, whether it be from lack of education or just ignorance, do not place high importance on washing their hands, just because they just don't understand why it's such a big deal. Some children report that they feel that they're going to miss out on something, especially at school. Children are during recess or lunch or hanging out with their friends, or there's a fun activity that the teacher might be doing. The students feel that if they waste any time washing their hands, they might not be able to do or participate in the same activities that their peers get to participate in. So some students report that they just don't wash their hands because they don't have time. Other students reported that they just forget. It's not a very important thing to them, so they just don't even think about it. And that could be because their parents don't place a high priority on washing their hands. And so the children feed off that. They see that their parents don't really care, and so they don't. They lack that education. And also, some children might feel peer pressure. Their friends might tell them that it's not cool to wash their hands, or they might get made fun of if they wash their hands. And so they decide that it's best just to not wash their hands. So studies also show that not washing your hands doesn't just affect the child, but it also can affect the friends of the child, the family of the child, and more importantly, in the school setting, it might affect teachers and other students. So according to the CDC, there's around 164 million days missed during the school year by children. And they say that averages out to about 5 days a year missed for these children, some more, some less. And when kids or teachers miss school, it's not only them that suffer, but their peers and their teachers as well. So the teachers, if the teachers miss school, the kids are not gaining the instruction that they need from the teachers, and they might fall behind. Or if the kids are getting sick and missing school, they miss out on vital instruction that these teachers might be handing out, and not able to go back and review with them because teachers have certain standards that they have to meet by a certain time. So those are some of the reasonings behind why hand hygiene is so important. Now we're going to get into why the CDC or when the CDC says you should wash your hands, and the list is kind of extensive. So the CDC says that you should wash your hands before, during, and after preparing food, before eating food, before and after caring for someone who might be sick, before or after treating a wound or a cut, after using the toilet, or after changing a diaper. If you're sick, after blowing your nose or coughing or sneezing or anything like that, after touching an animal, their feed, or after touching their waste, after handling pet food or pet treats, and lastly, if you touch garbage, the CDC recommends that you wash your hands after that occurs. So the CDC has some simple instructions. There's 5 steps to washing your hands. They say to wet your hands with clean running water and apply soap. The next step, you want to lather your hands by rubbing them together with the soap. You want to lather both sides of your hands, in between your hands, underneath your nails, so you're getting all the surfaces of your hands. You want to scrub your hands for at least 20 seconds. And a tip that they give is to sing the happy birthday song in your head 2 times. And that will be the 20 seconds that you need to wash your hands. And you want to, after you've lathered your hands and scrubbed your hands, you want to rinse your hands under the same clean running water, and then dry your hands using a clean towel or let them air dry. And so when you don't have access to soap and water, the CDC says that is then the opportunity when it is okay to use hand sanitizer. Which hand sanitizer is not the best way to get rid of germs, but if you don't have soap and water, hand sanitizer is a viable option. It can get rid of most germs, but it does not get rid of all the germs, making it least effective versus soap and water. So with using hand sanitizer, you want to apply the gel product to the palm of your hand and rub your hands together vigorously for about 20 seconds and let your hands dry, which should take about 20 seconds as well. So real quick before we exit the video, I would like to bring someone along that I'm going to interview. This is Amy Sampson. She's a teacher from a local 4th grade elementary school, and she's going to answer some questions and give us the inside scoop about her day-to-day. So Amy, tell me about your experiences in the elementary school level, and what issues do you see the most?
I work with what you would consider upper elementary, which is like 9, 10, 11 years old. And the most common hand hygiene issue is that students aren't washing their hands. They come from the bathroom and we're constantly reminding them, did you wash your hands? No, go back and do it. Or they sneeze into their hand and then touch everything else, and we have communal supplies, whether it's keyboards, pencils, scissors, that other students are constantly interacting with, and then in turn constantly touching their face or touching the doorknobs. And so there's a lot of germs that get spread very quickly and very easily.
Right. So what kind of instructions or resources does the school have to...
We have one medical professional on campus, and it's our clinic nurse, and she has very limited resources, and as a public school we have very little resources, and it's typically coming from the teacher outside of our original instruction. So there's not a whole lot of health resources that we have at the public school level.
Gotcha. Wow. So how often do you have students that are sick? How does it affect their progress, and how does it affect teachers?
Well, we have students out very readily. I had a student out this past week for the entire week and 2 days prior and the week before. And so this student has missed a lot of instruction, and not just from my class. We switch classes, so she's missed instruction at every level and in every area. And so now she's about a week and a half behind, and that's hard when the students are out because they miss things.
Right.
And as a teacher with 60 other students, we're not able to go back and focus on that one student and provide all the missed instruction.
Right.
And it's hard for them to catch up because then they feel frustrated because they're behind.
Right. Awesome. Well, that's all the time we have. So thank you for coming and letting me ask you a few questions and getting kind of the inside scoop. And remember to wash your hands.